Naomi, in your talk you identified 3 key roles for boards: setting direction, assessing performance and shaping culture. From your experience and research on NHS, do NHS Trust boards deliver on all of these roles to the same extent, or do they tend to put more emphasis on some than others?
I think that they probably are strongest on setting direction. I think the NHS as a whole has quite a good track record in being clear about where it wants to go, about writing documents and policies which are quite often quite aspirational. I think boards, like the rest of the NHS, haven't been quite so good around execution or around assessing performance. But I think where they've been least good is about discussing explicitly organisational cultural issues, and in particular what tone, what behaviours, what values they would like to see in their organisation, and how they themselves will model those behaviours.
Absolutely. Your research also touched on the distinguishing features of high-performing NHS Trust. Can you share with us some of those characteristics?
Yes, some of those characteristics, and I think I ought to perhaps put a warning note that the evidence is emerging. Some of those characteristics include a likelihood that the chief executive has been in post for a little while, or at least not a high turnover of chief executives. It's also likely to include a focus on clinical care and safety, patient safety issues. It's also going to be associated with, on the board, non-executive directors who contribute more at board meetings, as can be measured literally by the board minutes and how much they appear to contribute to the discussions. Those are probably the main characteristics of the high-performing boards. Perhaps I should add one last one, which was a surprise to us, which is there is an association between high-performing organisations in the NHS and the number of women on boards. But because it was an exploratory study, we're going to pursue that a little further.
Oh, we'll wait to hear some more on that one. What should boards be doing then to ensure that their non-executive directors can make an effective contribution? Is there something about the way that those non-execs are trained to perform their roles?
I think that non-executives do benefit from training, but I think also before the training, I think the recruitment and selection of non-executive directors is very important. And something that perhaps requires renewed attention because there's a lack of diversity. I don't mean gender, but I mean a lack of diversity in terms of experience. But also, I think we need to try to recruit for what I would call the grit in the oyster or the court jester. A board must have that kind of challenge as well as the focus on strategy and performance. In terms of training, non-executive directors do benefit from training separately, but also collective board development is absolutely invaluable, whereby the whole board, the executive directors, the chief exec get together and focus on common issues and learn together and learn to get to know each other, actually.
Do board members need specific support to know the right questions to ask about the quality of care for patients and safety? It was an issue that some of the clinical members of our audience today touched on.
Yes, I think I wouldn't necessarily select individuals. I think they all have separate different needs. So I think the medical director, because they have a specific responsibility in terms of patient safety, do have particular requirements. But I think more than that, I think boards individually and collectively probably need better training on what I would call the science of decision making. If you look at how boards take decisions, it's quite often what we'd call type 1 or intuitive decision making, as opposed to reflective, rational decision making, having considered all the options. So I guess there's some generic material that needs to be talked through, as well as roles for individual board members, including, for example, the chair and the chief executive and their role on the board.
In your paper, Naomi, you mentioned the role of a senior independent director that some boards have. Could you tell us a bit more about that position, how that works?
Yes, I think this is a role that we're not absolutely clear how that can be most effectively discharged, but certainly the Higgs report recommended that we had such a role, and they provide a challenge, a particular challenge to the chair. And also they represent the stakeholders, in our case really the patients, in a way that other board members don't have as their special role. So I think if the Senior Independent Director focuses on those two, which is, it is my job specifically to reflect back to the chair some strengths and weaknesses in the way in which he or she may be operating, and also to be the conscience of the patient, then I think that would go at least some way to discharging that role.
The other group that has that role in reflecting the patient and public voice are governors.
Yes.
Do you think the NHS is doing enough to support the these stakeholders on boards?
Well, what I would say about the what I call the two-tier model we've got with Foundation Trusts is that I don't think there's enough clarity yet about the rationale for the role of the governor and the role of the management board in foundation trusts, and therefore I think governors are themselves quite often and report that they're a bit confused, but also feel quite disempowered because they're not sure how much control they actually really do have and what that term holding to account really does mean, and to what extent they can move beyond their representative role, because it's a sort of stakeholder model, isn't it, the Council of Governors, to embody that collective holding to account. So I think there's more work to be done in terms of clarification and perhaps learning from elsewhere about how this could work more effectively.
Absolutely. So more to be done around not only defining what they're there to do, but how they then should bring that constructive challenge
Absolutely.
to the board of directors that can be quite powerful.
Indeed, it could be. Yes, yes, that's right.
Naomi, thank you so much
You're very
for
welcome.
sharing an academic but highly readable and very useful paper. Thank you.
Good, thank you. Thank you.